experts are deeply concerned about the far-reaching consequences of the Trump administration's restrictive measures imposed on the Centers for Disease Control and Prevention, CDC, particularly in light of a massive tuberculosis, TB, outbreak in Kansas, one of the largest ever recorded in the United States. This unprecedented surge serves as a stark warning, highlighting the fragility of the nation's public health infrastructure. David Dowdy, a professor of epidemiology at the Johns Hopkins Bloomberg School of Public Health, aptly describes these TB outbreaks as a canary in the coal mine, a clear indicator of underlying systemic weaknesses. The alarming scale of the Kansas outbreak underscores this point. Since January 2024, 67 active TB cases have been identified across just 2 counties. This number surpasses the typical annual case count for the entire state, a state with a population significantly larger than the affected area. To put this into perspective, these 2 counties constitute less than 3% of Kansas's total population, according to 2023 U.S. Census data. This disproportionate concentration of cases within such a small geographic area is profoundly alarming and suggests a potential failure in early detection and containment strategies, failures that may be exacerbated by the constraints placed on public health agencies. The national context further exacerbates this crisis. The Trump administration's actions, implemented during its initial weeks in office, severely hampered the CDC and other federal health agencies by imposing a comprehensive communications blackout. This silencing of vital public health information significantly impeded the timely dissemination of critical updates and warnings, hindering proactive measures crucial for mitigating the spread of infectious diseases. The impact is evident not only in the Kansas outbreak, but also in the potential exacerbation of other public health challenges. This deliberate suppression of information extended to the systematic removal of hundreds of pages from health agency websites. This action, mandated by an executive order from Donald Trump, aimed to eliminate references to race, gender, sexual identity, disability, and other protected identities. While some of this information has since been restored, the process has been far from seamless. Many pages have been reinstated with significant edits and omissions, reflecting the lasting damage inflicted by this censorship. This deliberate deletion of vital information significantly impaired the ability of public health officials to effectively communicate with and address the needs of vulnerable populations, further undermining public health efforts. The ramifications extend beyond the immediate crisis. The suppression of data and the hampered communication capabilities have created a chilling effect. Researchers and public health professionals are now hesitant to publish findings or raise concerns, fearing potential repercussions. This self-censorship further inhibits the free exchange of crucial information and impedes crucial research, ultimately jeopardizing the nation's ability to effectively combat public health threats. The impact is evident in the delayed publication and subsequent muted dissemination of a significant report on a 2021-22 TB outbreak in Kansas. This report, originally intended for the Morbidity and Mortality Weekly Report, MMWR, a traditionally prominent source of vital public health data, now sits largely unnoticed in the significantly diminished publication. The silence surrounding this and similar reports is deeply concerning, signaling a dangerous trend toward the suppression of crucial public health information. This episode serves as a cautionary tale, demonstrating the devastating consequences of political interference in public health. The chilling effect on scientific discourse, the hampered ability of health agencies to communicate effectively, and the suppression of critical data all combine to create a perfect storm, leaving the nation vulnerable to future outbreaks and jeopardizing the health and well-being of its citizens. The Kansas TB outbreak, therefore, is not merely a localized event. It's a stark warning signal of a much larger systemic failure, a failure that has been exacerbated by deliberate political actions that have undermined the core functions of vital public health agencies. The potential implications are far-reaching and demand immediate attention and corrective action. The ongoing silence surrounding this crisis only amplifies the concern and underscores the need for urgent reforms to safeguard public health from future political interference.